is hypotension. Hypotension. Now, let's try to get an overview or the understanding of hypotension or low blood pressure. Your blood pressure, if you say blood pressure, is a pressure that pushes against your arteries, that's the blood vessel, with each heartbeat. That is the blood pressure we all talk about. And so we need some reasonable amount of pressure for the body to work beautifully, for blood to get to your brain, to your organs, for everything to be stable. The essence of blood flowing in you is so important. You see, blood is the life of the flesh. So blood carrying oxygen and nutrients, the vitamin and mineral should flow in your body. But then if you have a low blood pressure, it means that your circulation can be poor. So having a low blood pressure in general may sound like it's a good thing. Well, it can be only good if you don't have any serious symptoms like dizziness or fainting or numbness or tingling, or also ensure that your arteries are free. Because if you have low blood pressure and your arteries are filled up, your blood vessels are filled up, they're narrowed and stiff, then of course you are in for trouble. The trouble can be stroke, heart attack, sudden cardiac death, kidney failure, and the brain disorders. If you have low blood pressure plus plugging of the arteries, right? Now, so let's move on now to some insight, to get some more insight. Many people may say, okay, I want to have low blood pressure because high blood pressure is dangerous. Yes, high blood pressure is definitely dangerous, but low blood pressure, that is caused by disease, systemic disease or underlying health problem, can be even fatal. But we will find out very soon. In severe cases, low blood pressure can be life-threatening because it can lead to shock. There won't be any blood even getting to your brain at all, and the body will be in shock. Now, when you go to hospital and you take your read, the doctor takes your reading, the reading lower than 90 millimeters of mercury, the stroke Hg, below 90, that is the systolic pressure, and then below 60, that is the diastolic pressure. If it is below 60 and is below 90, we say it's a low blood pressure. Well, when we say systolic pressure, listeners, what is systolic pressure? That is the top number, right? When you go to hospital, you say the top one. The systolic pressure is a pressure that helps to supply your body with blood. Is the pressure that helps to supply your body with blood. And the diastolic pressure, that is the second value, is the pressure when your heart is at rest. It supplies your heart with blood by filling the coronary artery. The coronary artery is the artery which supplies blood directly to your heart. So there is amount of pressure that you need to have with a good amount of blood in your heart. And there's also a reasonable amount of blood that you need to have, that is systolic pressure, to have good circulation in your body. That is the systolic pressure. So now, when we say that somebody has a high blood pressure, it means that a person's pressure reading is something like 140 over 90 and more. So if your pressure is 140 and 90 over 90, it means you are on the border. And that means that you have to be cautious. So anything above that is what? High blood pressure. But the question I want to ask you here is that, is blood pressure a disease? Well, I think you know the answer. The answer is no, it's not a disease. Blood pressure is simply adaptive mechanism. It's adaptive condition in your body telling you that something is wrong. Something has gone wrong, possibly with your kidneys or with your arteries, maybe arteries filling up, or something is wrong with the brain, or something is wrong with your heart, or something is wrong with your thyroid or adrenal gland. definitely there's something wrong somewhere. And normally what I've mentioned is the most common reasons why a person's pressure may go up. But right now we're talking about low blood pressure. That's what we are talking about. And if someone has a low blood pressure, as I'm saying, it can lead to stroke, it can lead to heart attacks, it can lead to kidney failure because that individual doesn't have enough blood flowing in the body, so the organs may not be working well as they should, especially the brain and the filters like the kidneys. Now, let's come to the symptoms of low blood pressure. How do you know you have low blood pressure or hypotension? Now, as we're saying that when your blood is not sufficient to deliver enough oxygen to the organs of your body, the organ do not work properly and can be temporary or permanently damaged. Now, as we know, the most common symptoms of low blood pressure are indicated is dizziness, feeling actually dizzy, lightheadedness, dizziness, and then a condition called syncope. Syncope just simply means fainting. If somebody is experiencing syncope, it means that the person may suddenly fall down, and about 30, 40 minutes, 45 minutes, the person may not know where he or she is fainting, that unconsciousness. But after maybe 30 seconds, the person may come back to consciousness. It's called syncope. It means at that point, there's not enough blood getting to the brain. So that is syncope. Now, that individual may also experience that fatigue, weakness, because the amount of blood moving in the body is reduced, it's restricted with oxygen. So that person doesn't have enough energy. There's always fatigue, always tired. When we go on that person also may lack concentration. That person may not be able to concentrate. We can get confused. That individual also may experience a kidney disease. Why? Because if there is not enough blood flowing through the kidneys may not be able to filter the blood well. So there will be even accumulation of toxins in the body. So if there's accumulation of toxins in the body, it serves as the foundation of inflammation. And inflammation is the foundation of diseases. And that person may also experience depression, the sadness, depression. And then the clumsy, or what they call clammy skin. It means a wet skin and sweaty skin. That person may experience confusion, especially with the elderly. They may be confused. And that person may have cold body, cold skin, cold body, pale skin. That individual may also experience that rapid, shallow breathing, because there's not enough oxygen moving around. So your body tries to compensate by breathing very, very quickly to compensate, try to get more oxygen in the body. That individual may feel weak and there's a low, rapid pulse. Now, when we move on, we also can look at two types of hypotension or low blood pressure. We have what is called the orthostatic type. The orthostatic, it means that it is the drop in your blood pressure that occurs when you change position. When you change position from sitting or lying to standing. So when you're lying or you're sitting and you rise suddenly, your pressure may drop. And because the blood should settle naturally, should settle in your veins, in your leg. So if your pressure is already low and you stand very quickly while lying or standing, you may experience that orthostatic type of blood pressure, and it's quite common in the elderly or older adults. And we have another type, and that is the neutrally mediated. Neutrally mediated normally happens to young adults or children. Normally, this individual may be standing for long. When they stand for long, their pressure may come down. And those individuals, it doesn't matter if they're older adults or young adults, if they are emotionally disturbed, they can also experience low blood pressure. And if you have a low blood pressure, definitely oxygenation will be low in the body. That can cause really a real problem. Now, let's come at this point to causes and the risk factors involved here. The causes and the risk factors, and then the complications. That is what we are going to talk about now. But before then, please let me put this number on the platform. Maybe you have low blood pressure or high blood pressure or any form of chronic disease. Please do not hesitate to give me a call, and then you will see that God will use me to help you. Now, the number calling outside the UK is +44 738 464 7300. When you're calling within the UK, is 0738 464 7300. And the second number is +44 745 988 9152. This number within the UK is 0745 988 9152. You can give me a call, or maybe somebody needs help. Pass the number to that person, and God will definitely bless you for that. Now, let's come to causes, risk factors of low blood pressure. Who actually gets this problem? Who gets this condition here? Now, as we know, you see, blood pressure is usually lowest at night. Blood pressure is lowest at night and rises sharply on walking. You see, so when you are walking, you need a bit more energy. Okay, so your pressure will naturally increase, and then you have more oxygen to give you the energy to walk. So that is the reason why when you are walking, you are rushing to a GP office or your health provider's office for a checkup, and you get there immediately. You shouldn't check your blood pressure. You should sit down for at least 15 minutes for your pressure to come to normalize before taking the readings. So we rush in, and then your pressure is taken. That pressure that you read will not be the actual pressure that you really needed. And unfortunately, people do that, and they put them on medications. Really unfortunate. So when you are lying, your blood pressure reduces. It's very natural. When you are going to bed, your heart rate reduces. Your pressure goes down so that you'll be able to sleep. That's why it's not advisable to drink coffee in the evening, or drink maybe ginger tea, or there's anything that will stimulate your circulation. Because if it stimulates it, of course, you can't sleep. Your pressure could build up. Your heart will be beating, will be working. And so it's not also advisable to do exercises in the evening. Do exercise in the evening is counterproductive. Now, the medical condition that can cause low blood pressure, including here, pregnancy. A woman being pregnant, it means, of course, there's extra life. So there's expansion of circulation. Because there's expansion of circulation, naturally, the circulatory system, naturally, pressure will lower. So a pregnant woman may naturally have low blood pressure because of the extra life in her. So that is a medical condition here. And then heart problem. The heart condition like bradycardia. Bradycardia is your heart beating very slowly. The heart rate is so slow. So bradycardia can lead to low blood pressure. And bradycardia actually is a heart problem. It's a heart disorder, which is not healthy at all for your brain and for in general, your circulatory system. Another cause here is the endocrine problem. If I talk about endocrine problem, I'm talking about parathyroid. The parathyroid disease, the thyroid glands, they are the 4 glands around your thyroid. Your thyroid gland is like a butterfly shape at the base of your neck. But no, I'm not talking about the thyroid gland. I'm talking about the parathyroid glands. They are very small glands just around the thyroid. And if there is a disorder, also the disease, and it can cause low blood pressure. So we know now that if a person has a low blood pressure, there's a cause. There could be a serious medical condition, because if you have problem with your parathyroids, it could be a real issue. It could be a real problem. It can even lead to the opposite situation, that is high blood pressure. It can lead to other health conditions as well. Now, when we also move on, we also see other conditions like dehydration. Dehydration is just you have insufficient amount of fluid in your body. Normally, some individuals may be drinking a lot of fluid, a lot of water, but still they are dehydrated because they don't know how to drink water. You see, there is a secret of drinking water for water to get into your cells, into your tissues. Apart from the early morning water, that should be enough, about 300 mils. I wouldn't advocate or recommend you to drink like 1 liter. No, it's not advisable to sit down for you to be so thirsty and drink a lot of water. That water will not get into your body well. You will still feel dehydrated, but a lot of water you drink at once will cause problems to your kidneys. So apart from the first morning warm water that you may drink, like a glass of warm water, really recommended first in the morning, even before brushing your teeth. It's a really great thing to start the day. Apart from that, the rest of the day, you should be sipping, drink your water little by little. And that type of drinking can get really into your tissues or into your body. And it's so friendly also for your kidneys. That's how what is really favorable for your kidneys. Now that you drink a lot of water. But individuals can be dehydrated because of diarrhea, or vomiting. That could be in extreme situation. But individuals also can be dehydrated because they are on diuretics. They are on, example, blood pressure medication. Blood pressure medication from the hospital is normally diuretics. They cause you to pass urine a lot. It may get water from your body, and in doing so, of course, your kidneys will be overworking. That's one of the reasons why blood pressure medication can cause gradual damaging effect on your kidneys, right? But then you lose water without you knowing anything. So sometimes those individuals with a high blood pressure may have very low blood pressure without knowing anything. And then they may be experiencing unnecessary medical conditions that they don't know because the body is not giving them any symptoms at all. Now, also blood loss. Blood loss could be in extreme situation. When there's maybe injury, accident or something, blood loss, that is an extreme situation. But then severe infections. Severe infection can also lead to low blood pressure. Severe allergic reaction. Severe allergic reaction can also lead to low blood pressure. It can actually cause breathing problems, severe allergic reaction, severe problems, itching, and swollen throat. That is if you have severe allergic reaction. But lack of nutrients in your diet, lack of nutrients. It means nutrients like vitamin B12, folate, iron, that can keep your body actually going or help your body to produce red blood cells, which carries oxygen around. So if you're lacking nutrients, it can also lead to low blood pressure. That is another issue here. So, listeners, we eat not because we are hungry. That is now the primary reason. The primary reason to eat is because of nutrients. So whatever food you eat, ask yourself, how much nutrient is it there in those food for me? So that's what you're going to ask yourself. Not because you are hungry. Some people, they are hungry, they just get anything and they just put in their mouth and eat. That is a real problem. Think about the nutrient. So we need nutrients all the time. Anytime we eat anything, we should think about the nutrient. So Prescription drugs. I've mentioned blood pressure medication that can lead to extreme low blood pressure, and then antidepressants. Antidepressants can also lead to low blood pressure. And those men that have problems with, sexual dysfunction, erectile dysfunction, and they are on Viagra. Viagra can lead to low blood pressure. And when your pressure is low and that individual is performing sexual act, it's very dangerous, because if you have a low pressure and you are on Viagra and you are performing a sexual act, your heart can be damaged, your brain in the long, it's not immediately bad, mid-term and long-term, you could have very serious problem. Now, what are the complications? The complications of low blood pressure is very clear. If you have low blood pressure, that individual may experience what they call syncope, a sudden faint. You faint because there's not enough blood getting to the brain. So that person may fall suddenly. So sudden falls. Sudden falls is normally because of enough blood not getting to the brain. Sudden fall. And when you suddenly fall, and if unfortunately you don't have strong bones, especially women in menopause, if you don't have strong bones, you have osteoporosis, then you may experience fractures. And then that could lead to mobility problems. That individual may be carrying a walking stick or maybe in a wheelchair, And as I was saying, that a low blood pressure naturally leads to a condition that you don't have enough blood getting to the brain with oxygen and nutrients. So the brain will shrink more quickly before its time. Naturally, the brain shrinks with age, but we can delay the shrinkage process by 20, 30 years if we have strong circulation. So if you have a low blood pressure, definitely your brain may shrink earlier, and you may have brain disorders like dementia, forgetfulness. You may have Alzheimer's or Parkinson's diseases. You may have brain disorders, quite serious, and you may also have a damaging effect to the kidney. It can lead to kidney failure and heart problems. So these are some of the complications of low blood pressure. That is hypotension. Lovely, lovely listeners. Thank you very much for tuning in today, supporting this program. You've been listening to Dr. James, a certified natural medical practitioner in London, in the UK. Please visit us on YouTube, and please put in Dr. James-Natural Link, Dr. James-Natural Link, and you can just listen to a lot of presentations, a lot of them there. And please subscribe so that you don't lose any of the programs. I don't do only Thursday, Sunday. Sometimes I do just short messages sent around, and you will also have it. You'll be prompted. So please just visit, and please press the like button and share. Oh, thank you so much for joining us today. And then we'll have another beautiful time that is on Thursday. Every Thursday, 8 to 9, and Sundays, 8 to 9, we have this lovely time together on this platform, Natural Link Radio. Thanks a lot for joining me today, and thank you for your support. God richly bless you the coming week. Thank you very much, and we will actually share a wonderful time the coming Thursday. Thank you.
Tell it all. If I had 10,000 tongues, it still won't be enough. Umetenda mengi kwangu, siwezi eleza yote.